Tell us about that experience. How does health communication intersect with public health strategy and workforce development?
Yeah, so it's really centered around the knowledge, the attitudes, and the beliefs that populations have relating to health and healthcare and health services. And it can be explored in a number of ways, especially at the doctoral level, just like you have dermatologists, you have cardiologists. When you're earning a PhD, so I have a PhD in health communication, there are specialization areas. I have some colleagues that studied specific health campaigns and health programs and evaluated the effectiveness of those. I specifically looked into the experience of South African women and their access to breast health services. And so I was looking at their knowledge, attitudes, and beliefs toward the healthcare system. And what does that mean for them getting screened early? What does that mean for the kind of support they need around them to ultimately help reduce the breast cancer rates in South Africa? And then, of course, throughout my career, I've just applied that knowledge in terms of moving from data to programs, serving special populations, and healthcare access in general. So, um, it's a journey. Even earning the doctorate is just the beginning, which I try to tell the students that I mentor in doctoral programs to do your best and know that you have a whole career and lifetime to keep refining and doing different things.
Absolutely. And for the work that you did with those ladies in South Africa, what what was the I guess was it like did you go to South Africa and do interviews or what was that entire project or process like?
Oh, yes. And I mean, it's even an intersection of culture. I'll say that again. It is an intersection of culture for me to have traveled to South Africa, 18 hours on a plane from DC to Senegal to Johannesburg to Cape Town to get there. I felt like the sun rose and set multiple times. I'm not sure how that works. Um, but what I was able to do while I was there was to engage in surveys as well as interviews to conduct the research. And there just has to be an agility there, and I think that applies to all of public health. There has to be an agility there to accomplish the goals we have set for ourselves or the goals that we need to accomplish our programs or accomplish our specific grant requirements. I had set up and had the best laid plans to conduct my surveys at a health department there. And I got to the health department, the gate was closed. I was talking to someone through the gate. They said, "We don't know you. Why are you here?" Mind you, I had set up everything, scheduled everything in advance. And so, I literally ended up walking down a dirt road saying, "What am I going to do? I have traveled across the world to collect data and they don't know me. What does this mean?" So I'm walking down the dirt road, the dirt's blowing in my face, and I look up. I'm certainly a woman of faith. I look up and there was a clinic, an open clinic to my left. I walked in there and I said, "Hey, can I do these surveys here? Please let me do these surveys here." And I kind of explained the story and I was able to do that. So if you're focused on your mission, if you're focused on the purpose of your research, you can absolutely connect with people that are willing to help, that are trying to work in the same direction. But it was definitely a journey to do that. And then in terms of the interviews, I really embedded it as an opportunity to connect in the various communities. And so I was connecting with community groups and speaking with women that were part of those community groups. So, not just descending upon Cape Town to do my research and leave, but really forming relationships. I still am connected with several of them today, forming relationships as well, so that you're offering something and infusing something back into their community, also not just taking.
Yeah, love that. And yeah, I can only imagine how you were feeling. Probably pretty defeated at first, and then we're able to figure it out and get things going. Which I think really speaks to I guess you wanting to do this work and finding a way, right?
Hey, no choice. I needed to graduate. Somebody needs surveys.
That's right. That's right.